All right. Hi, Dr. Schechter. How are you today?
Good morning. Nice to
Good
be
morning.
here. I'm doing well.
Good, good. I'm just going to start with a little brief intro to you, and then we'll go into our question. Dr. Schechter is a family and sports medicine doctor specializing in tension myositis syndrome, also known as TMS, and treating the whole patient, mind, and body. Today, we're going to be talking about mind body for teens because the last time we spoke, you had, the Mind Body Workbook and you had launched a Mind Body for Teens. So why teens?
Well, for a few decades, I've treated a lot of patients in their 20s, 30s, 40s, 50s, and 60s and beyond with stress-related conditions. And I enjoy helping them to get better. Most do. But I was always interested in the idea of trying to prevent these conditions, not just treat them. So the idea is to get to the young people and educate them about these principles, teach them skills, make them more resilient to stress internalizing into their body and causing different medical conditions.
That
You
is
mentioned TMS,
Mhm.
also known as tension myoneural syndrome, tension myositis syndrome. Some people call it the mind-body syndrome. A new phrase is psychophysiologic disorder. Regardless of what you call it, at its essence, the principle is that stress and tension going on in the mind and brain and emotions get internalized,
Yes,
especially when we stuff down our feelings
right.
and come out as a physical condition, such as a tension headache, low back pain, teeth grinding, stomach issues like irritable bowel syndrome, sometimes neck pain, arm pain, a variety of symptoms, some of which are very difficult or impossible for physicians to diagnose, and some of which they think they have a diagnosis, but then the treatment proves only temporary or ineffective. And many of these people eventually find me through the books that I've written and the websites and the internet and want to take a different approach.
Right.
And so my approach is different. My approach is really learning about the person as an entire person living in the context of a family
Yeah.
or having been born from a family if it's an older person. And that integrated knowledge I have with a more detailed psychosocial history allows me to open up areas that other conventional and alternative practitioners have not looked into. Specifically for adolescents, there's a lot of stress during adolescence. Boy, this last year plus has been the pandemic, of course, and that's going to stick with people for a while, unfortunately.
And
There's
as
also,
adolescents, wouldn't they sort of not know that they even are experiencing stress?
well, you're right. They may not know it. And that's my goal, is to make them more aware of it. And one of the ways I'm doing that is I've written a mind body workbook for teenagers, which consists of writing exercises to help teens reduce stress and feel better emotionally and physically. These writing exercises make an individual who is not aware of some of their feelings and their significance more aware of them. And even if you're aware of them, it helps you to process it or experience it in a safe way inside of a spiral bound workbook, which is what the workbook consists of.
Can you walk us through a little bit of your workbook?
I'd be happy to. Here's the cover.
Mm-hmm.
And the reason I did it spiral bound instead of a traditional book is because then you can lay it flat to answer questions. So there's a couple of introductory pages, and then there are lay flat
Perfect.
pages where, for day one, for example, there are questions. The
Mm-hmm.
questions are designed as prompts. The goal is to get the person writing in the workbook, just like my other workbook for adults,
Yeah.
to just get them to write about their feelings, write about what's going on in their life. So my question number one on day one for the teen workbook is, what has made you upset in the past few days? What about it made you feel this way? And the person who sits down and confronts that question can usually find something.
Right.
And if they're willing to do this and they feel comfortable doing this, they just start writing. They just start writing about what made them upset, and they try to connect it to anything that they understand about why they felt that way. The very process of writing has been shown in multiple research studies to be therapeutically effective.
Right.
Acknowledging your feelings, expressing your feelings, very important. No one has to read what the adolescent or adult has written in one of these workbooks.
Right. It's very
really
private.
for yourself. In fact, if you write in it and you feel like you don't have a safe place to hide it, you could tear up the page.
Yeah.
It is very valuable to write it. Some of the studies have shown that it's more effective to handwrite it than it is to, for example, keyboard it into a computer or a phone. But those are more effective than recording it on your voice memo. And that's much more effective than just thinking the answers.
Just thinking it. Thinking not going to help anything.
Yeah, which turns out not to be effective at all. So the actual process, we call it journaling or expressive writing, is very important. And there are 4 questions on the first day. Question number 3, make a short list, 5 to 7 items that make you feel stressed. And after you write the list, number them 1 to 7, with 1 being the most stressful. So we're trying to get people to focus on an area of life that's not given as much emphasis.
Right.
There's a lot of emphasis on nutrition. There's a lot of emphasis on exercise.
Right.
There's emphasis on getting into a good school. There's emphasis
That's a stressor.
There's emphasis on being popular or finding the right music on Spotify. But there isn't a lot of emphasis on looking at the internal world, looking at the emotional world, looking at the feelings you have. And feelings that are not dealt with, especially traumas from the present and the past, can lead to both emotional and physical health conditions.
Yeah, and I would imagine that in writing down the stressors, like 5 to 7 of them, naturally, if you're going to write it down and you pinpoint it, and you pinpoint that, throughout a week, you keep naming these things and you're numbering them, that a sane mind would figure out a way to mitigate those stressors. Like if that's a stress for you, then maybe you should not work on that or take that out of your schedule or find another way.
Well, stage 1 is to identify these things.
Yeah.
And stage 2 might be sharing some of these feelings with a close friend or a teacher or a counselor or a parent. Certainly emotional problem solving can go on in one's head, and if necessary, with a professional, if it turns out that things come out that are a little bit too intense. But you have to start somewhere, and if you're not spending any time at all looking systematically at your emotional life, you may be missing some important things.
Absolutely.
And we know that teenagers are struggling with stress in school, stress from parents and teachers to do well and to get good grades. We see some of the manifestations of that in excessive vaping, which is kind of to some degree replaced smoking, neither one of which is a healthy habit.
No.
And we see it in certainly a variety of other conditions, be it eating disorders, body image issues, depression, all the way up to, unfortunately, suicide. So our goal is catch things early, prevent, teach skills, and give people an outlet for emotional expression. This workbook, which consists of a 10-day training process, is not designed to be the end. It's designed to be the beginning.
Right.
Just like you might begin a 10-day course in tennis or something. Doesn't mean you're a master tennis player. It means you've now learned the forehand and backhand. Now you have to start practicing it.
Right. Do you ever, and this is with any of your clients, have you found that, like, let's say they do vape or they smoke, are they finding that the smoking is tied to a stress point and that it has helped them to sort of give up smoking or some kind of addictive behavior?
I think that most smokers that I've talked to acknowledge that they use it as a stress release to some degree or another. If we teach younger people other ways to healthily reduce stress, then hopefully they can first of all, never get started with smoking and vaping, or if they do, they can realize that there's better ways to manage feelings and to manage stress and to
Right.
manage worries.
Right.
So yes, I think that you're right about that.
Do you think that so this mind body workbook for teens, it's easy for anybody to use. They don't need any guidance really. You could just give it to a teenager and just ask them to use it. I mean,
Well,
teenagers are really kind of
teenagers might
hard
not look. It's hard to get adolescents to necessarily do what you want them to
to
do.
right.
But I start with a very simple introduction of a few pages, and we've got it's written in a simple format. Um, we have a few more pages at the end. I've done a video explaining how to do this, which will also be available to people who start using the workbook.
Oh, okay.
And it's not hard to do, really. I mean, you could just start writing in a blank notebook as well. The reason why I created the structured workbook is because I found with my patients that it's easy to write in a blank notebook for 3 or 4 days. It's hard to write for a few weeks or longer because you kind of feel like you run out of things to write about.
Right.
So by giving some structure, it's not designed to replace the creativity or to replace the free flow of ideas, but it's designed to, in a sense, structure that, get that started, kind of a training program. You know, I mean, when you start a new sport, to give that analogy again, you might want to hit 30 backhands and then hit 30 serves and then hit 30 forehands just to kind of get systematically started. Eventually, you'll play a game.
Right.
So the workbook gives you a structure within which to learn how to look at your emotions and how to do expressive writing as a skill that you can take with you beyond your teenage
Forever.
years to your college years, your adult years. And again, as I mentioned, if people write things that they don't want anyone to see, it's perfectly okay to rip up that page. The spiral bound allows you to tear it out. And if you use it in any other format, you certainly can write it on paper and then tear it up or shred it or burn it or whatever you want to do. But writing it out is very effective rather than just, as I mentioned, thinking the answers or
Or
other
typing.
options. Typing in a computer with a password protected file is another way that you might seek some security, and it's not a terrible option either.
Mhm.
But the ideal option is to write. It seems like there's something about the handwriting, the way it connects to the brain, that seems a little more effective for emotional expression. Maybe it just slows us down a little bit compared to typing, because most people can keyboard faster than they can handwrite.
Right. Right. It has you become more expressive in your brain, and then of course the synapses coming together in your writing. What is the age range would you suggest for your workbook for teens?
Well, I wrote it for teens, and so by definition, that'd be about 13 to 18. I mean, the workbook says students grades 6 through 12,
Mhm.
and I stand by that. I've had several psychologists review it, including a child psychology specialist, and feel that the format and language is suitable for both early adolescents and teenagers, and that youth can gain quite a bit from it. So it's designed for that age group, 13 to 18, ages grades 6 to 12. And we hope to use it in the school system as well. So that's why we're talking about grade levels as well as ages.
Right, right. I mean, now I'm like, I think I'm gonna go get some and mail them to all my friends that have teenage kids.
Well,
You know?
there's a hospital in Santa Barbara that ordered 25 of them because they want to use it with some of their adolescent patients. And I'm looking forward to some feedback from them pretty soon on how that's going. So
Wonderful.
that's the first kind of large scale test. And then individual people have obtained it and have been using it or have given it to their adolescent family members.
Well, I think now is a good time to really kind of buy one. And if you have, adolescents in your household, to buy them and give them to them if they don't use it immediately. If it's sitting there and they're not feeling very good about themselves, I'm sure that workbook just being there and accessible will draw them to it just because it's there. I feel like it's very simple to look at. It's not, it's unassuming and kind of curiosity engaging.
I'll also add that the proceeds from the sales of this workbook will be going into this nonprofit program I'm developing to improve the curriculum of middle school and high schools and gear them a little bit toward emotional learning. So this particular workbook, it all goes into this fund. So
Exciting.
you're doing good.
Congratulations.
You're doing good at the same time by obtaining one of these.
Perfect. Oh, that's wonderful. Oh, I had one more quick question. Okay, so where can people buy this workbook
Well, it's available on Amazon.
besides Amazon? Because I'm not promoting Amazon.
It's available in my office in Culver City. And you can also order it via my website and receive it directly from us rather than from any corporate entities.
Thank you. That's wonderful. I will be sure to include the link to your website in our notes.
Thank you.
All right, Dr. Schechter, is there anything else you'd like to add about this wonderful Mind Body for Teens workbook?
No, I think it's something that adolescents can do, and it might be in some cases their parents want to get their own version if they're dealing with issues. Again, the workbook for adults is a little more focused on getting rid of chronic pain and other stress-related disorders, but those are so common, and many of you may have that as well.
Yeah.
The teen workbook is focused on skill development and general emotional health, so it doesn't have a focus on any particular condition or disorder. But if
Oh,
you do this,
perfect.
if you do decide you want to do one with your teenager, you can get the regular Mind Body workbook, which is by the same author with a different title and a different cover. It's got a blue cover instead of a green cover. You could do it together. And again, you don't have to share your answers with the teenager. It's kind of parallel activity in the sense that you're showing them that your feelings are appropriate but private. If they want to share some of their feelings, that's fine. But I'm not saying you have to. It can be done as a private exercise of emotional expression, and it still has quite a bit of benefit with that. And if the adolescent feels, and they're encouraged to do so with the workbook, if they feel that they're finding things that they need additional help for, they're encouraged to seek out a parent, a doctor, a counselor at school, a teacher, or a therapist.
Right. Now, are you finding that adolescents are experiencing any sort of chronic pain at their age? Or is this more just like a preventative?
This one is preventative, but I do see some people 17, 18, 19 who can get stuck in that chronic pain cycle and have been able to help them successfully. It seems to be that you kind of go from that end of high school into early college phase. And for some people, life gets, even more complicated. And that's a period of time where, in my practice, I do see some people, some young people who need help with tension headaches or low back pain that proves to be a stress-related disorder, this concept of tension myoneural or tension myositis syndrome, TMS, or mind-body syndrome, as it's also called.
Okay, preventative. And it's just exercises that they'll be able to go back to for the rest of their lives.
Yeah, we hope to learn a skill that they can absolutely rely on for emotional expression, really anywhere they go.
Thanks, Dr. Schechter.
Enjoyed talking with you. Thank you for having me.
We'll talk soon.